Hi, my name is Monty. Today I'm going to be demonstrating a head to toe assessment. This is my volunteer, and she's going to go ahead and consent for the video.
My name is Erica Tupo, and I consent for Marisol Medina to do this video. I am over the age of 18.
Alright, first things first, I'm going to knock on the patient's door. I'm going to close the door behind me for patient privacy. I'm going to hand hygiene and then apply the proper PPE. And as I'm applying the proper PPE, I'm going to introduce myself to the patient. Hi, my name is Madi. Today I'm going to be your nurse. So I'm going to ask the patient what their full name and date of birth. Can I have your full name and date of birth, please?
My name is Erica Tupo. My date of birth is 5/15/81.
Thank you. I'm going to go ahead and check the patient's wristband for verification. Okay, perfect. Thank you so much. I'm going to be doing a full head to toe exam on you due to your knee replacement. How are you doing?
I'm doing fine.
That's good. I wanted to know your, do you mind telling me why you're here?
It's for an exam for my knee replacement.
Thank you. And then do you mind letting me know what time it is?
It is 1 p.m.
And do you know where you are?
Trinity Hospital.
Thank you. So patient is alert and oriented to time and place and person due to her knowing her full name upon me asking her name. So on the Glasgow Coma scale, she would be a 15, especially since she's able to understand me asking her questions. Her eyes are moving voluntarily, non-voluntarily, and she's able to speak. Okay, so now that I got started with that, I'm gonna go ahead and start the exam. I'm going to have to touch you from head to toe. If you ever start to feel uncomfortable, go ahead and let me know, okay?
Okay.
And then before I do that, I'm going to go ahead and check her vitals. All of her vitals are currently stable. Her blood pressure is at 120/80. Her oxygen level is at 99% on room air. Her respiratory rate is at 16. And her pulse is at 80 beats per minute. Alright, so first thing, I'm going to go ahead and inspect the patient's hair just to look and see if there's any thinning or any balding or any potential lice or any dandruff, which I don't see any. And then I'm going to go ahead and start with, I'm going to palpate the patient's scalp to see if she has any lesions or any tenderness as well as bumps. Okay, I'm going to go ahead and touch your head. If you have any discomfort, go ahead and let me know. Okay, perfect. Patient doesn't have any lesions. Patient doesn't have any tenderness and nor any lumps on her head. Next thing, I'm going to go ahead and check the patient's ears using a pen light. So I'm going to go ahead and take a look inside of your ears. Okay. Patient's ears bilaterally are clear. There is non-impaction of serum, and patient's membrane is on a gray shiny color. Alright, next thing, I'm going to go ahead and take a look at the patient's eye symmetry. Patient's eyes are bilaterally symmetrical, and then I'm going to go ahead and shine a light in the patient's eyes to check to see if the patient's pupils are active to light. So I'm going to go ahead and let the patient know. I'm going to go ahead and flash a light towards you. I'm going to cover your left eye, and then I'm going to do the same thing on the other side. Patient's eyes bilaterally are active, and retract to the light. Okay, and then the next thing, I'm going to go ahead and take a look at the patient's nose to see if it's symmetrical. The patient's nose does look symmetrical, and then I'm going to go ahead and take a look inside the patient's nostrils to see if she has any obstructions in her nostrils and see what color her mucus is. Alright, patient's mucus is pink. I'm going to go ahead and palpate now just to see if there's any lumps on the patient's sinuses. I'm going to go ahead and press on your nose. Let me know if you feel any pain. patient's sinuses are non-tender. So now I'm going to go ahead and take a look inside the patient's mouth. The patient's lips are currently pink. They're non-cyanotic. So patient has good oxygen. Go ahead and open up your mouth for me, please, and I'm going to take a look. All right, go ahead and stick out your tongue for me. Thank you. Say ah. Ah. Okay, perfect. So, patient's mouth is currently pink and moist. Do you wear dentures?
No.
Okay. Patient does not wear dentures. All of patient's teeth are currently there. I see the patient's tonsils as well as the patient's vulva, and both look very clean and pink and moist. Do you have any pain?
No, I do not.
Do you have a cough?
No, I do not.
Do you have, okay, perfect. Thank you. So now that I'm done with that, I'm gonna go ahead and go down to the patient's neck. I'm gonna first inspect to see if I can see any visible lumps. I don't see any visible lumps. I'm gonna look at the back of the neck as well to see if there's any discoloration, and there's no discoloration to the neck. I'm gonna go ahead and palpate on the patient's neck for any lumps. Let me know if you feel any pain. Okay, patient has no lumps, patient has no lesions, and patient is non-tender. I'm gonna go ahead and palpate on the patient's thorax now too. Let me know if you feel any pain. Patient has no pain and patient has no lumps either. All right, so next thing, I'm gonna go ahead and take a look at patient's skin to see if patient's skin is under distress or has any lesions, any lumps, any bruises, if the patient's skin is dry or if the patient's skin is blue, and to see if the patient has tinting for possible dehydration. So I'm going to take a look at your skin. As you can see, patient does have pants on. If in the real life setting, patient would be in a gown. But other than that, patient's skin does not seem to be blue. Patient does not have any tinting, so patient is not dehydrated, which is a good sign. All right, so now I'm going to go ahead and listen to the patient's lungs. Lord. Okay, go ahead and sit up for me, and then I'm going to listen to the patient's anterior and posterior lungs. Alrighty, so I'm going to just have you breathe regularly, and I'm going to listen to your lungs really quickly, okay?
Yes.
Okay, I'm going to go ahead and go to your back now.
Okay.
Take a deep breath in and then exhale. Patient's lungs, anterior and posterior, are both clear. They do not have any crackles, any wheezing, nor raunchy. I'm going to go ahead and continue with the patient's cardiac assessment now.